Hello guys, welcome back to our channel. In this essential video, we're breaking down the 8 key warning signs of a heart attack that everyone should know. Recognizing these symptoms early can be life-saving, so let's dive into it. First, let's talk about one of the busiest organs of the whole body, the heart. On average, a healthy adult heart pumps about 5 to 7 liters of blood per minute. This means approximately 6,000 to 7,500 liters of blood per day. This means our heart is one of the most vital organs of the body. If any abnormality in the body or any simple effect over heart may lead to serious life-threatening complications. Also, other factors related to age, kidney, hormonal imbalance, ionic imbalance, hypoxia, coronary block and sudden cardiac shock may be caused. Cardiovascular diseases, CVDs, continue to be a significant global health challenge, with alarming statistics regarding mortality and complications. In 2021, approximately 20.5 million people died from cardiovascular diseases, making it the leading cause of death globally. This figure represents a substantial increase from earlier years, with deaths rising from 12.1 million in 1990 to 20.5 million in 2021, a surge of nearly 60% over 3 decades. An estimated 620 million people are currently living with heart and circulatory diseases globally. Each year, around 60 million new cases of heart or circulatory diseases are diagnosed. The escalating numbers related to cardiovascular disease highlight an urgent need for public health initiatives aimed at prevention and management. With effective strategies in place, many of these deaths could be prevented, emphasizing the importance of awareness and proactive health measures across all demographics. Now, without doing late, let's talk about the 8 early warning signs of a heart attack. What you need to know. Number 1. Chest discomfort. One of the most common signs of a heart attack is chest discomfort. Particularly in the context of a heart attack, it can arise from several major causes. The most critical is myocardial infarction, which occurs when blood flow to a part of the heart muscle is blocked, often resulting in severe chest pain, described as pressure, tightness, or a crushing sensation. This pain may radiate to the shoulders, arms, neck, jaw, or back, and typically does not subside with rest. Another significant cause is angina, which is chest pain due to reduced blood flow to the heart, often triggered by exertion or stress, but usually relieved by rest. Other heart-related conditions contributing to chest discomfort include pericarditis, inflammation of the heart's surrounding sac, myocarditis, inflammation of the heart muscle, and aortic dissection, a tear in the aorta leading to sudden severe pain. Additionally, complications from conditions like hypertrophic cardiomyopathy can lead to chest discomfort during physical activity. Understanding these potential causes is vital for recognizing the signs of a heart attack and seeking prompt medical attention. Let's talk about another warning signs. Number 2. Pain. Radiating to other areas. Heart attack pain doesn't always stay in the chest. It can radiate to other areas like your shoulders, arms, neck, back, or jaw. This is often mistaken for muscle strain or indigestion, but it's a serious warning sign. Number 3. Shortness of breath. Shortness of breath, or dyspnea, is a prevalent symptom associated with myocardial infarction, heart attack, and arises primarily due to impaired cardiac function. During a heart attack, the obstruction of blood flow to the heart muscle leads to ischemia and subsequent necrosis, which diminishes the heart's ability to pump effectively. This inefficiency results in pulmonary congestion as blood backs up in the pulmonary circulation, causing fluid accumulation in the alveoli, known as pulmonary edema. Consequently, patients may experience significant difficulty breathing due to reduced oxygen exchange and increased respiratory effort required to compensate for inadequate cardiac output. Additionally, The sympathetic nervous system's response to pain and stress during a heart attack can further elevate respiratory rates, exacerbating the sensation of breathlessness. In severe cases, this can lead to acute respiratory distress, characterized by rapid onset of shortness of breath and potential hypoxemia, necessitating immediate medical intervention. Let's dive into another potential external signs of heart attack. That is number 4, cold sweats. Cold sweats are a significant symptom associated with heart attack and can arise from the body's physiological response to acute cardiovascular distress. During a heart attack, the obstruction of blood flow to the heart muscle leads to ischemia, triggering a cascade of autonomic nervous system responses. The sympathetic nervous system becomes activated, resulting in increased catecholamine release, which can induce sweating as part of the body's fight-or-flight response. This sweating may manifest as cold and clammy skin. The presence of cold sweats during a heart attack is indicative of significant stress on the cardiovascular system and may occur even in the absence of classic symptoms like chest pain, particularly in populations such as women or individuals with diabetes who may experience atypical presentations. Recognizing cold sweats as a potential warning sign of a heart attack is crucial for timely medical intervention, as it underscores the urgency of seeking emergency care to mitigate potential myocardial damage and improve outcomes. Number 5. Nausea and vomiting. Nausea and vomiting are notable symptoms that can occur during a heart attack, often reflecting the complex interplay between cardiac distress and gastrointestinal responses. The underlying mechanisms are thought to involve activation of the autonomic nervous system, particularly the vagus nerve, which transmits signals between the heart and the gastrointestinal tract. During a heart attack, ischemic injury to the myocardium can lead to the release of various biochemical mediators, including catecholamines and inflammatory cytokines, which may stimulate the vagal pathways associated with nausea. Research indicates that these symptoms are more prevalent in patients experiencing larger infarctions, as evidenced by a correlation between nausea and elevated serum creatine kinase levels, suggesting that greater myocardial damage is associated with increased gastrointestinal disturbances. Additionally, inferior wall infarctions have been linked to a higher incidence of nausea and vomiting compared to anterior wall infarctions, although this relationship is not absolute. Overall, the presence of nausea and vomiting during an acute myocardial infarction serves as an important clinical indicator that may aid in diagnosing the severity and extent of cardiac damage, warranting immediate medical evaluation and intervention. Now, let's move into another important associated signs of heart attack. That is number 6, lightheadedness or dizziness. Lightheadedness or dizziness is a significant symptom that can occur during a heart attack, primarily resulting from compromised hemodynamics and reduced cerebral perfusion. During a heart attack, the obstruction of coronary blood flow leads to ischemia, which can cause arrhythmias, abnormal heart rhythms that may manifest as bradycardia, slow heart rate, or tachycardia, rapid heart rate. These arrhythmias can disrupt the heart's ability to maintain adequate cardiac output, resulting in diminished blood flow to the brain and subsequent lightheadedness. Additionally, the activation of the autonomic nervous system in response to acute cardiac stress can further exacerbate feelings of dizziness. The interplay between myocardial ischemia, potential cardiogenic shock, and the resultant drop in systemic blood pressure can precipitate these symptoms, often indicating a severe underlying cardiac event. Recognizing lightheadedness as a potential warning sign of a heart attack is crucial for prompt medical intervention, as it may signify significant myocardial damage and a need for immediate therapeutic measures. Number 7. Unusual fatigue. Unusual fatigue is a significant symptom that can precede a heart attack, particularly in women, and is often indicative of underlying cardiac distress. Research indicates that many individuals may experience unexplained fatigue weeks or even months prior to the event, characterized by an overwhelming sense of tiredness that is disproportionate to the level of exertion. This fatigue is thought to result from the heart's impaired ability to pump effectively due to ischemia, leading to inadequate oxygen delivery to peripheral tissues and increased metabolic demands on the body. The autonomic nervous system's response to myocardial stress may also contribute to this sensation, as heightened sympathetic activity can lead to feelings of exhaustion and malaise. In clinical studies, a substantial proportion of women reported unusual fatigue as a precursor symptom, often accompanied by other atypical manifestations such as shortness of breath and sleep disturbances. Recognizing unusual fatigue as a potential warning sign of an impending heart attack is crucial for early intervention and improved outcomes in at-risk populations. Now, let's dive into the final or last, most prominent and common characteristics of heart attack, that is number 8, indigestion or heartburn-like symptoms. Indigestion or heartburn-like symptoms can occur during a heart attack and are often misinterpreted due to their overlapping presentation with gastrointestinal distress. The pathophysiological basis for these symptoms during a heart attack involves the activation of the autonomic nervous system, particularly the vagus nerve, which innervates both the heart and the gastrointestinal tract. Ischemia of the myocardium can lead to increased vagal tone, resulting in sensations of discomfort in the upper abdomen or chest that mimic indigestion. Additionally, the inflammatory mediators released during myocardial injury may stimulate visceral pain pathways, contributing to nausea and a burning sensation in the chest. Notably, women are more likely to report atypical symptoms, such as indigestion or heartburn, during a heart attack, which can lead to delays in seeking appropriate medical care. Therefore, distinguishing between true gastrointestinal symptoms and those indicative of cardiac events is crucial for timely intervention, as both conditions can present with similar discomfort, yet require vastly different management approaches. To recap, the 8 warning signs of a heart attack include chest discomfort, pain radiating to other areas, shortness of breath, cold sweats, nausea, lightheadedness, unusual fatigue, and indigestion-like symptoms. Recognizing these signs and acting fast can make a crucial difference. Don't wait if you or someone else shows these symptoms. Call emergency services immediately, even if you're unsure. Better safe than sorry. And remember, each person's experience with heart attack symptoms can vary. Thanks for watching. Be sure to like, share, and subscribe to stay informed about your health and wellness.